Welcome to the Aesthetic Talk, the premier podcast for aesthetic professionals around the world. I'm your host, Jonathan McLean. I'm the proud founder of elite aesthetic healthcare recruiting firm, McLean Aesthetics, connecting the best talent with leading med spas, dermatology, and plastic surgery offices nationwide. On this show, you'll hear from industry experts, medical professionals, and CEOs as they share their journey, provide insight on the latest trends, and offer invaluable advice. To ensure you don't miss out on any of the latest conversation with our experts, subscribe on YouTube and all your favorite podcast platforms.
The Aesthetic Talk Podcast.
Welcome back, everybody, to the Aesthetic Talk. I'm your host, Jonathan McLean, and today we have a special guest. She is a physician assistant in the Naples area. She's a med spa owner. She's an aesthetic speaker and trainer. Please help me to introduce Dana.
Hi, Jonathan. Thank you for having me. I'm so excited to be here. I appreciate you asking me on.
Yeah, no worries. I've been following you via Instagram and your career, and you've been doing some exciting things. So I'm excited for you to talk about your experience today.
For sure. I'm excited to get into it.
Awesome. So I always like to start off just by asking my guests a little bit about how they got in the industry and kind of what led them down this path.
Well, I'm a PA. I'm a physician assistant. I've been a PA since 1993. So that's 30 years now. And my background was originally surgery and critical care. I stayed at home with my kids for a while after, back when I had kids, we started having kids. My oldest is 25. And then I wanted to go back to work, and I really didn't want to go back to the operating room. And one of my girlfriends was doing aesthetics. Actually, she was doing lasers at the time, laser hair removal. And that's how I got into the industry. That was in 2009. So I've been doing aesthetics for about, 14 years or so.
Nice. That's super cool. So 2009 versus now, tell us how the industry was back then. I'm interested to know.
I think it was not as common. People didn't talk about doing Botox where I was working. We didn't even offer injectables at the time. It was strictly laser hair removal. It was a national chain. And it was a couple years after that I left that spa and got a job at a different spa. They hired me for my laser experience, but I started doing tattoo removal. And that's really when I got into injectables. But it was really up and coming. There wasn't a lot of training. One of the main training places were either through industry, so Allergan or Galderma, which it still is that way, or Palette. They have some online courses. They also have some wonderful live events in a lot of different cities. And that was how I utilized getting into the industry and starting my training journey. But there definitely was not training centers all over the place like there is now. It was difficult.
Yeah. So it wasn't like the average American getting Botox or these procedures back then, because there was only Botox and machines. What type of person or what type of demographic you think was getting procedures back then?
I would say 35 and up, and probably majority of people 45 to 65. And I think it still is that way, but I think it's getting younger and younger. And people were getting it. They just weren't talking about it back then. I think now it's a lot more mainstream and commonplace. It's like if you're not getting Botox as you get older, it's a little more uncommon. It was hard. I feel like it was hard to get into the industry. I still think it's hard to get into the industry for people that don't know how to do it.
Yeah, for sure. I get those, being a recruiter, I get those questions all the time. Like, how do I get in? I've been trying so long to get in. Like, what are some methods? What would you tell them?
I would say just get your foot in the door somehow, some way. So, offer to work as a medical assistant, even if you're an RN or an NP or a PA, get some experience, even if it's periphery. So even if it's a lower paid job or a lower income job, but you are going to get some hands-on, you're going to be able to watch people, you're going to be able to shadow. I mean, I just hired a new nurse practitioner and I'm using her as a medical assistant for the first several months that she's here, really just to get her used to my practice and have her watch everything I do by my side all day long for 8 hours a day to train her.
That makes sense. Because it really is repetition and really getting that knowledge into your brain so much that you could just do it.
Right. And really anything that you can get your hands on online, it shows that you're passionate about teaching yourself. So you can go do a course, and the people that applied to work for me that had done a course, it did catch my eye, but it was really the people that said, oh, I'm on Patreon, I'm following so-and-so. I worked as an intern at a dermatology office. I shadowed in medical school. It showed me that it wasn't just saying that they wanted to get into the industry. They were actually taking some action to get even small amounts of experience to do that, to get hands-on.
Yeah, that makes sense. That makes a lot of sense. Yeah, I know right now you have your own practice, and congratulations to that, because anybody who opens their own practice, it's a lot of hard work. So not only open it, but to keep it open. So definitely congratulations on that. But I wanted to talk about how many years you've worked in the industry prior to feeling confident enough to say, hey, I'm going to open my own place.
Well, I started working in the industry in 2009. I started doing injectables in 2012, and I opened my practice in 2017. So that was, 7 years, I guess, of 8 years of experience in the industry, with injectables being about 5 of those years.
So you were a great injector at that point because you've been doing it for 7 years. But you and me both know it takes more than injecting to really operate a great business. What are some things that you learned early on that, hey, I should know this, or as a business owner, you should definitely know this?
Well, I worked for several different places. So I worked for large practices, small practices, corporate practices, and you learn from every practice that you are working for. And so I took things away from the smaller practices that I really liked. And I also took some things from the larger corporate offices, such as compliance and legal, medical director, who you need to supervise you. State of Florida, as you know, you're in Florida, is very strict. So really being able to be compliant in our state was important to me, but also being small enough that I could nurture my staff and treat my patients the way I wanted to treat them, and not like they were in and out the door. I really wanted to treat my patients like family or close friends and build a relationship with them. So that was really important. I didn't want to see someone for 15 minutes for Botox and then never see them again. So I really wanted to build that long-term relationship.
Yeah, and I like how you put that, because I think people forget, especially with the med spas, they're private pay businesses. People are coming here because they electively want to do this. They want to spend their money that, whatever money that they have to get these things done. So they want the best type of experience and service. Do you find the same thing?
Oh, for sure. I think people appreciate that, we're getting to know each other. And over time, we're going to work together to serve their skincare needs or their aesthetic needs. And we're going to discuss goals. I'm going to make recommendations for them that are honest and truthful. And even if that is a referral down the street to a plastic surgeon for a facelift, if I feel like I can't help them with Botox and fillers for what they really want to achieve, I do not have a problem sending them down the road to go to a colleague that can better serve their needs.
Gotcha. And that makes sense. That makes a lot of sense. And I like how you put that also, because some people just try to sell, hey, I just want to get this sell. Let me just sell this amount of filler, versus I think this person really does need a facelift instead of filler. Let me actually just recommend out.
I think what you put out into the world comes back tenfold. So if you treat your patients as you would your mother, your aunt, your sister, they will be grateful and trust you. And the relationship, you need trust. So that is number one thing. If you're trying to sell them something that they really don't need, they're not going to trust you in the future, and they won't stay with you or refer other patients to you, which is best. Word of mouth is the best marketing that you can possibly get.
Yeah. And what I've noticed a lot is med spas and aesthetic industry is almost a community business, right? So like you said, if you're not doing good work, it spreads throughout the community. Like maybe you shouldn't try that injector, and vice versa. If you're doing amazing work, everyone wants to be there, right?
For sure. It's everything. It's not just It's the experience when they come in, the front desk smiling and being kind to them, treating them like family, like they appreciate their business. And then, you trying to do the best you can with their procedure. And no one is perfect. So, people get complications, people get lumps or bumps, and that happens. But, holding their hand and being with them on that journey, even if you get a complication, will build a long-term relationship with that patient. And that experience is really important.
Yes, yes. Now, I want to ask you, now you've been in the industry for a while now. What inspires you to keep going and to stay in this industry and not go to another specialty or do something else?
Oh my gosh, I can't ever imagine doing anything else, Jonathan. I love it. I think people that catch the aesthetic bug, it almost turns into an obsession. I just cannot ever imagine doing anything else. And now that I'm teaching, I just love it. I love sharing my knowledge. I love serving the community. I love, being on podcasts like yours that are going to teach and help other injectors get into the industry, because I think it's the perfect job. Like, I don't even feel like I'm working when I go to work, because I get to have relationships that I love. I get to do art. I get to have technical procedures that I do all day. It's just the perfect thing.
Yeah, I would even have to say I work on the outside, and just learning about what you guys do inside the office is so exciting for myself. I feel you. I understand that.
And it's changing all the time. So, there's always something new. There's new technology. It's, keeping on top of it. It's like, exosomes are coming and regenerative medicine. And it's super exciting.
Yeah, for sure. For sure. Now, as a teacher, what are the number one question that you get asked from students? Like, what's the number one question that students ask?
Number one question. That's a tough question. I guess, how do you get into the industry? But for brand new injectors, I teach for Galderma. They make Dysport and Restylane products, and their units are a little bit different than Botox. So Botox comes in a 100-unit vial and Dysport comes in a 300-unit vial. And sometimes that can be a little confusing converting those units. So that's something that I do a lot of teaching on, is dilutions and unit conversion. And I would say cannula. I teach a lot of cannula because it's a little less risk of bruising. It's a little less risk, tiny bit, not no risk, but a little less risk of complications like vascular occlusions. So a lot of the new injectors that I train really want to spend some time learning cannula.
So as a new injector, which one would you suggest that we use? The cannula?
I think if you're a good injector, you need to be competent at both cannula and needle, because there are certain situations where you're going to want to use both. So as an artist, you want to be able to use both of those techniques. But I started at needle because we didn't really have cannulas. They were just starting out back then. But I would say maybe comfort level, it would be better to start with cannula and then learn needle.
Awesome.
The Aesthetic Talk Podcast.
Now we're going to switch into one of our segments where we ask you questions and you give your opinion. It's called red flag or green flag. So I'll give you a hot topic and you just tell me if it's a red flag, which means absolutely not, or if it's a green flag, which is a go.
Okay.
Right? So raising your prices, is that a red flag or a green flag?
A green flag.
Okay, why? Tell us why.
Well, I think that as your business matures, you do need to raise your prices. Typically, you're increasing your staffing, so you have more overhead. You're going from maybe one room to multiple rooms. Your overhead goes up. You've got more front desk. You have medical assistants, and you're trying to grow your practice. Maybe you're trying to buy, devices. You can't have bargain bottom pricing. Sometimes when you first start out, if you're in a little one-room suite and it's just you don't have any staff, you could probably tolerate having a little bit lower pricing. But as you gain more experience, you shouldn't be lowering your price. You should only be raising your price.
Yeah, for sure. For sure. But what do you say to your customer? Like, how do you justify that to the customers that have been coming to you? Like, how does that work?
My expenses are higher and the companies raise their price. So, how much we're paying for Juvederm or Restylane is going up every year, sometimes twice a year. So we need to keep up with that.
Okay. Yeah, definitely. All right. Our next one, buying a device when you open your med spa. Is that a red flag or green flag?
For me, it's a green flag. I know that's controversial, but I bought a device. I opened in May. I bought my first device in July. So I'm a big device person. I love devices. I love laser. I'm really into it. So for me, it's a green flag.
Okay. And why is it a hot, like, what are the downfalls? Because I know you said the hot topic item. What are the downfalls?
I think that if you don't have a market for it, if you don't
Mm.
have a patient base that wants that device, if you don't have an idea how you're going to sell it to your patients, if you are not running it yourself, or do you have the right people on your staff to run it? Are they legally licensed? In the state of Florida, we're very strict. So even though there are training centers all over the place that are training to do laser, that doesn't necessarily mean that legally they are allowed to perform that procedure in the state that you're in. It's very state by state. Laser companies will try to sell you, they'll try to sell ice to an Eskimo. So you have to be mindful what works for your practice and what your patients really want and need.
Hmm. I can definitely agree with that. And like you said, you got to have the patient base, but also, like you also said, it's a marketing technique, right? It's not just, hey, I have this machine, sit here and just maybe hopefully somebody will buy it. Having those parties in the beginning, really telling everybody this exists.
Yeah. My patients were asking for procedures with
Mm.
the specific device that I purchased. I have a Cyton BBL Moxie combination. Well, then I had a Halo, but I just bought the BBL. That was the first thing that I got. And my patients were asking for it. They know I'm super passionate about skin and healthy skin and having your skin look good for your age and sun damage and preventing sun damage. So for me, it really made sense to buy that device and it's paid off. And now I have two of them and I have a Moxie and a Halo and I have all kinds of devices. But you really have to have a pulse on what your patients want or what people are calling your office for and you're sending them down the road for. So if you're getting 10 calls a day for laser hair removal, well, maybe you need to buy a laser hair removal and invest in that device.
Yeah, yeah. You're almost running like a survey, to get perspective of what people are wanting. And once you have that demand, then actually buying it and going into it.
Right. But also, you need to make sure you have the money to pay for it. I
Yeah.
did take a loan to purchase my first broadband light device, but I haven't had to take a loan to purchase a device since then. And that was really scary when I first opened up to have a loan that I needed to pay off. So really making sure you feel comfortable with the payments that you're going to need to make on that device, how many procedures will you have to do to pay it off, all of these things you need to think about. And injectables, you can purchase as you go. So if you're only seeing 2 Botox patients a week, you can purchase 2 vials of Botox and, have, let's say on Thursday, you have one more. Well, you could purchase that an extra vial on Wednesday and they overnight it to you and you'll have that product by the next day. So as far as overhead, you can not need quite so much product on your shelf.
Yeah, yeah. I can definitely understand that. Now we're gonna move on to our next topic. It's TikTok marketing. Is that a red flag or a green flag?
I'm trying to get into TikTok and I'm failing miserably. I think TikTok's great. I would love to be better at it. I tend to be an Instagram girl, but I'm a little older. So I think if you're good at TikTok, it makes sense to market on there. And you have to be mindful who you're going to bring in from TikTok or, what you're selling. I like to use my social media to connect with my patient base. So which really means patients that are already seeing me in my practice. That's my favorite way to connect with them is through Instagram, or if they're on TikTok, you can, but sometimes with TikTok, your videos go to people all over the world. So they aren't necessarily people that can come and sit in your chair and get services from you. So you have to be mindful, what are you selling? If you're an injector and you're selling trainings to other injectors and you have like an online course, totally makes sense. Or if you're selling skincare and they can order online to you, makes sense to really invest in TikTok. But if it's really more patients in your chair, you would have to use it to specifically target local people, I would think. And I don't know exactly how TikTok does that. You might know more about TikTok than I do.
What you just said makes sense because a lot of people, in the aesthetic industry, I see getting a lot of views on their videos, and that's amazing. But the med spa industry is like a community-based industry. So if they're not in that area, maybe they won't come see you. Versus on Instagram, you can really target more so the area that you want to be seen in. So, I mean, it is a compelling question. I'm not quite sure. I'm not quite sure though.
I mean, I like to, if I'm going to boost a post, I'm going to boost it to like a 5-mile radius around my office. But I love using Instagram as a direct communication to my patients and what I'm up to and what I'm doing. And I think that's, it's social. You want to be social with those people. And they come in and they're like, what am I doing? What am I up to? And then we talk about it. It's great.
On the first visit, like I've heard providers say on the first visit, they just talk and sometimes they don't even give the procedure to really educate. Are you more education first? Is that what you lead with?
I think you have to take a pulse of what that patient is coming there for and really have some good kind of, I call it EQ, to what is going to serve them best. If it's just a conversation, just have a conversation. Most of the people that come to me, I end up doing something to them because they've waited a while to get into my chair and it's more than just a consult. But I really think you have to talk to the patient and figure out why they're there, what they want to do they feel comfortable, and go from there.
Yes, for sure.
The Aesthetic Talk Podcast.
Now we're going to move into our next segment called The Hot Seat, where we ask hottest trends in the emerging industry.
Okay, let's do it.
All right, so let's talk about regenerative medicine. I had a lot of providers that do love it, and they say they swear by it. And then I had some providers say, I don't really know if I agree with the practices of like HRT and bioidentical hormones. I would love to get your perspective.
Well, I don't do hormones in my practice, but I am postmenopausal. So there's that. So I love bioregenerative medicine as far as Sculptra and Radiesse or hyperdilute Radiesse. Those are two of my favorite products. And I use them all day long. I have tons of it in my face. So it's kept me young for the past, or younger looking, I think, for the last 15 years. I really think it is the fountain of youth. As far as bioidentical hormones, and, I am on some hormones. I don't have pellets, but I have a patch. And I'll tell you, I feel 100% better treating my, low estrogen symptoms, as long, assuming you don't have any risk factors. It's not in my wheelhouse of things that I am an expert at. So I don't offer it at my clinic currently. But I would consider in the future maybe a new hire who is an expert in that and bringing it on, because I think it has a place in our industry. But I focus on, the things that I'm an expert at, and that's how I serve my patients. But I'm all for it, assuming there's no risk factors.
Yes. Okay, great. What about semaglutide? It's been hot and raging in the area lately. A lot of people are doing it. A lot of practices are implementing it. What are your thoughts?
So I don't offer it at my practice, but I think it has a huge place in the future of our population. I have read some really, really positive studies about, not only lowering inflammation and blood glucose, which glucose is and causes inflammation in the body. So the nerve cells don't like sugar. So, there's some studies that talk about possibly lower risk of Alzheimer's disease. I don't know if I've just heard it or I've heard studies. I haven't actually seen them about how it curbs alcohol cravings. So people that are on semaglutides tend to want less alcohol. So that is a huge plus. There are some risks involved with thyroid cancer. So I think people need to be, this is still a medical procedure and there are risks involved, and you want to go to somebody who can counsel you and be experienced. But I think if somebody is going to somebody that is trustworthy and honest and using it for the right reasons, it makes sense. I do think that if somebody is already thin, they really should not be taking semaglutide to get even thinner. So we need to be mindful of body dysmorphia and issues with that. But if you're, an honest, trustworthy provider, you're not going to be giving somebody like that semaglutide anyway.
Yeah, for sure. For sure. I can agree with that too. And I just want to point out, like, just hearing these things, it is so amazing what this industry can do to have a better quality of life for individuals that maybe aren't aware of it. So I hope that other people can become aware of this industry, because I talk to people all over the world and some people don't even know that these things exist, haven't been exposed to it. So the industry has a long way to go, but it's just amazing at what's happening right now.
Oh, yeah, it's super exciting. I think semaglutide is going to be eventually available in an oral form. It actually already is. It's just, I think the dosage is a little high. I don't know that much about it, to be honest, but this is just what the little that I do know. And, there are people that think that eventually it's going to be like Lipitor, like everybody's going to be on it. So it'll be interesting to see. I don't know, because we're not carrying it. So I don't have as good of a pulse on that product as maybe some of your other people that you've had on the show, but certainly hot topic and super exciting.
Yes, for sure. For sure. Now I want to talk about Daxxify.
Oh,
Are you
okay.
familiar with that?
Yes, I am. I have Revance products in my practice, but I don't have Daxxify. But I have used it and tried it, and I've done some training with it, so I'm very familiar with it.
Awesome. I would love to hear your thoughts on it.
So I think it's a neurotoxin type A, daxibotulinum toxin type A. It does, reduce wrinkles. I think it does what it says it's doing. I have heard mixed reviews as far as exactly what the longevity is. And many of the people that I've talked to are kind of saying it's not quite lasting that 6 months. It's more double what your typical toxin. So if you normally do 20 units of Botox, Daxi, and it lasts 3 months or 2 months, your Daxi is going to last 4 months. So not quite the longevity of 6 months, but about double what you would typically get. The pricing on it's expensive. And that is why I don't carry it in my practice, just because I feel like the market to charge people double or almost double for something that's not actually going to last that 6 months is a hard pill to swallow. So if pricing comes down, I'll probably start offering it. But at this point, it doesn't make sense for my practice.
Yeah. Yeah, it's a fairly new product, so the pricing will be obviously very high. But as time goes on, it'll go down more and more because new products will come out.
Yeah. I mean, it does work and it's great. It's just expensive.
Yeah. Nice. Okay. That's very interesting to know, because I know when it came out, a lot of people were like in the middle, like, what's going to happen? We have to charge the patients twice as much? Is it going to last 6 months? But it's good to see like the product actually being used and the results actually happening.
Yeah. I mean, I think it's a great product and it needs to make business sense to bring it on. And I wouldn't mind having a little bit on my shelf to offer it to people that, come in and they've used it before and they really love it. And I may do that in the future, but it's a great product and works really well. We've used it on a couple staff members and they got some nice longevity, but it wasn't quite 6 months. It was more like 4.
Nice. So, I mean, that's still good though, because Botox is like 3. So
right. It's definitely more than the traditional dosage of Botox or Dysport. So a little bit longer.
Nice. All right. Awesome.
The Aesthetic Talk Podcast.
Now we're going to move into our last segment called Ask the Expert, where we ask you, the expert, viewers questions on what they would like to know about the industry.
Okay.
All right. So Sabrina, she's been in the industry for 3 years and she was able to save up $10,000 and she's looking to know where she should invest that in training.
Oh, $10,000 specifically for training.
Yeah.
My favorite training that I've done was Author Swift. He has several different ones, but his company is called Swift Beauty and it's expensive. It's about, I think, $5,000, or it may even be more than that now. It might be closer to 6. That he does, it's several days, and he does a cadaver class intertwined with and he's just an amazing speaker. His technique is beautiful. And he's probably who I got the number one, the most techniques out of was his class. In fact, I've gone back to train with him several times, probably 3 times. So super valuable.
Nice, nice. And just in general, as a provider, what are some good, like I've heard cadaver courses, I've heard online training, what would you kind of suggest as like, I know you said the Swift course, but maybe as a new provider?
As a new provider, I think as much hands-on that you can get in small groups or one-on-one is the most valuable. So, having someone, a mentor, watch over you as you inject over and over and over again, or as much as possible. Because sometimes, some of these courses you don't get to inject at all. So there's really, and it's one thing you can watch all day long, but you need to be the one doing the procedure and then having somebody, a mentor there correcting you if you're doing it wrong or showing you, hey, this is just turn your needle slightly this way. This is better. So I think, one-on-one is priceless. But as far as a course overview, love the Swift. If you can't do that, then try to get some one-on-one where you can spend the day with somebody and you can take some models and actually get some really good experience injecting and having them mentor you.
Yeah, I would agree with that. I think that's the best place to spend your money is really finding an injector area that's skilled and saying, hey, can I just pay you to, like you said, bring in some models and inject them for the day or however long you can able to do it.
I had a recent trainee that came and spent 4 hours with me, and I trained on everything, but she really wanted to focus on lips. So since that's all we were focused on, I think we had 3 or 4 lip models. It was a 4-hour training. And by the time we got to that 4th lip model, she had it down. So in having, the first one, I helped her through, and then I watched her and I watched her again. And I think that, just doing one person, it's really hard to really learn it well just on one model. Like you really need to do it and do it again and do it again. So, and I kind of learned to be a better trainer when we did that. I was like, oh my gosh, this was so great. Just doing this one procedure over and over and over again and seeing different lips because they're all different. It's like, okay, well, what's the approach to this one versus this other one that came in? Because everybody's, every patient has a different face. It's all individualized and customized. And just because you see it up on a big screen at a conference doesn't mean you're going to be able to take that exact same technique home and do it on your patients because your patients are different.
Yeah. How long would you say it takes to really, and I know everybody's different, could take somebody a year, could take somebody a couple months, but how long do you think, or how many people do you think you really ideally would have to work on to really feel confident with injecting?
I mean, I usually say like full-time a year, which it depends how many people you're seeing in that time. But, I would say really hundreds of people, ideally. It's a good question. And my brain says 100, but maybe it's less than that but to really, really, really feel confident, probably 100 for each procedure.
And the reason I just throw out that question out there, because I do get a lot of, well, not a lot, but I get some providers that will call me and they'll say, hey, I'm taking a weekend course and I'm going to go open my own med spa. And I just want to make sure that people know that's not really something that you can do just because, like you said, it takes almost a year to really feel confident in your craft.
I can't imagine opening a brand new business when I barely know how to do the procedures that I'm offering. So not only are you learning all of this business information, but you're also, learning how to do it because you have to portray to your patients that you're an authority, like you're an expert at this skill and you're going to take care of them. And if you're just learning yourself, it's really hard. It's different from the hospital where hospital's mentality was see one, do one, teach one. And that might work on, patients in the hospital, but in this industry, it's cash pay. Those patients can go down the street and see a plastic surgeon or dermatologist. So if you're going to compete with, 10 med spas within a mile of your office, which typically you are, you need to be an expert and hone your craft as best as you can if you want to be busy.
Yeah, that makes sense. All right, perfect. So we're going to move into our next question from Shay. She has been in the industry for 5 years, and she's looking to step away from working for somebody and kind of work for herself. What are some tips that you can give her to know that she's ready?
Oh, well, 5 years. I think 5 years, that's when I did it. So she's probably wanting to open something. So she needs to make sure she has a little savings set aside so that she can survive without getting paid a salary for a certain amount of time. I would plan on a year of not, barely paying yourself and investing most of the money back into your practice. If you're going to grow it, you probably need some seed money set up for purchasing product, your first and last month's rent, your insurance, all your licensing, your medical director. Typically, you're going to need to buy some sort of chair, some lighting, camera, iPad, computers. So, you're going to need, my guesstimate is about $50,000 just to open your doors. Maybe you could do less if you don't do retail product, but all of that is really important.
Yeah, and to my understanding, you have to pre-purchase these like Botox and fillers that you use, correct?
Well, yeah. I mean, you can do small orders. It doesn't have to be, a ton of product. I think with Botox, you only have to buy one vial at a time. I think with Dysport, it might be two. So there's minimums of what you're allowed to purchase. It's reasonable for the injectables, but I'm talking skincare. So if you're going to do, which usually you do some skincare, there's a opening order, and it could be $1,000 or it could be $5,000 depending on the skincare line. That's like a minimum buy-in is what they call it.
Yeah. And how did you choose, or what's some good ways to choose like which lines to pick?
Well, hopefully you get some samples and you try them out and you decide, which ones that you like, because you're not going to be able to recommend it if you don't like it. And typically, you're going to pick things that you think your patients need. So the same as the laser, like you want to have in your wheelhouse things that the patients need. So most people need a sunblock, a vitamin C, some sort of retinol, moisturizer, something to wash their face. So you don't have to start with a million products, start with just the basics. Most people wash their face. Most people should be wearing a sunblock. If they're not, they should be. Antioxidant. Those are the essentials in my opinion. So start small and then work out from there to the serums and all the extra stuff.
Awesome. Well, thank you, Dana, so much for sitting down with me, speaking
You're
more
welcome.
about the industry. Tell everybody your socials and how they can find you.
Okay. On social media, on Instagram, that's kind of the one that I'm on the most. I'm Naples Beauty Injector because I'm in Naples, Florida, which is in Southwest Florida. I have a great website, D-Lux where I do have a training page on that website where I offer a free download on how to take good clinical photography. And I think I have a consultation PDF that's a free download on there and has some information about if anybody ever wanted to train privately with me. And I also have some information about requesting me for Galderma trainings.
Awesome. And until next time, bye.
Bye, Jonathan.
The Aesthetic Talk Podcast.